All right, Dr. Steven Rhodes. How are you, sir?
Great. How are you today, Dave?
Doing really well. Doing really well. Thank you for coming on. I've been talking about you a lot, and especially with my diagnosis of MS and how the different routes that I wanted to take for the healing process and the things that you've been able to do for me and really for my family on the way here tonight. My daughter, she said I want to meet Dr. Steven. Because I want to thank him for what he's done for you, for my daddy and for our family. So
really
thank
sweet.
you. So but I want to introduce the world to you. That's why we wanted to bring you on. So please tell us about yourself, how you got started, early years, go as far back as you want, and kind of give us an idea as to how you got to where you are now.
Wow. Okay. Try and keep it down to an elevator pitch for you. So, Steve Rhodes, born and raised in little rural Alabama. So,
Wow.
in the middle of nowhere where you would never come across anything like acupuncture or esoteric thought or anything unless you go way north to Huntsville, where all the rocket scientists are. But where I was, it was a very rural area, very similar to the Eastern Shore growing up. Went to University of Alabama, joined the military, medical service corps officer, working with, our troops, frontline units, Ranger Battalion, Special Forces, deployments, as well as our community hospitals, medical centers. Did a Master's of Healthcare Administration through Baylor University with the military.
Wow.
Stayed with them, ran community hospitals, and also helped with large medical centers, working on the medical school side of applications and helping the physicians choose who were going to come in and be the interns and residents through the years. So a lot of great experiences with the military. Got to travel a lot, got to do a lot of things, got to see a lot of people doing amazing things. And part of that was, during that time, was getting the fun stuff of sliding down ropes out of helicopters or jumping out of airplanes and, fun stuff like that wherever you may be. But when I left the military, I ended up in Florida, first on the East Coast and then later on the West Coast, working for Sarasota Memorial Hospital. And while I was there, some of the fun times started to catch up, and I found out that it got to where my knees were hurting and I couldn't even walk upstairs between floors. And it got so bad that I went and talked to our physicians, because at that time I was head of the physician business office, and they were like, "Oh yeah, we'll refer you over to the ortho guys. We'll get you scoped. We'll get you set up for surgery. We'll do all these things." I'm like, "Oh, I'm a little too young to be doing this, I think." Okay?
Yeah.
My cousin, he had hips replaced at 38 or whatever, but he was running like 12 marathons a year or something. So there was a reason he burned his out, and I didn't think I should be in that bad a shape at that age. But somebody suggested acupuncture, and there was an acupuncture school in Florida, there in Sarasota, East West College of Natural Medicine. So I went there for a couple of visits, and then...
if you don't mind me asking, what year was that, give or take? I'm just trying to understand because I think part of my questioning is trying to understand sort of the evolution of acupuncture and your role with that.
Okay. All right. So I joined military in 1986.
Mm-hmm.
And so, we had, on some deployments, we had seen some of our allies, Japanese soldiers and others, that had acupuncture needles in their bags on the battlefield and treating in aid stations, because we were running aid stations for infantry battalions and deployments. So had seen it, had been exposed to it, and had seen that it worked good.
Mm-hmm.
Interesting concept, but still very Western medicine based, and didn't have a lot of time to really get into it and investigate it. But it was phenomenal or amazing that, okay, these guys are using needles to treat pain for bumps and bruises and things that we're giving ibuprofen and things for.
So this was actually a battlefield remedy.
Yeah.
Wow, that's amazing.
I didn't know that.
Neither did I.
Yeah. And actually, and I can't remember his name, but we did have a colonel a few years later who came along, and he has taken that battle. He took the same things that we were seeing, and he actually developed battlefield acupuncture, which the Marines use pretty extensively now.
Wow.
And there's some different points that you use to control pain and things, and he actually named it battlefield acupuncture. And I should know his name, but one of those things I should have researched before coming in, but didn't think about it. So that was 1986, and I got out in 97. So I was in Sarasota 2001. So let's call it 2002, 2003.
Okay.
Knees started going bad. And so I went, I had some treatments. I was like, okay, you're sticking needles in me. I'm pretty relaxed. I can take a nap. It's like, but I don't know what it's doing. And then one day I was down in my office, and my boss called and said she wanted to see me right away. And she was up on the second floor, and she was, it was an urgent tone.
Yeah.
To appear in front of her desk quickly. So, I grabbed my notebooks or whatever, and I went out and I ran up the stairs. And when I got to the top of the stairs, I just literally stopped and said, "Oh my God," or expressions similar to that, because I had not been able to walk up those stairs for the last 3 weeks. I had been taking the elevator, and I just literally ran up them that day, and I was like,
without even like second guessing.
Right, didn't even think about it.
Wow.
I just ran up. The pain was gone. My knees were working great. And I was really, really shocked at that point in time that it didn't hurt at all. I think I even ran back down the steps and then ran back up one more time. It's like,
am I dreaming? Yeah.
This is huge. This is great. So went in. And then after that, I met a friend of mine who, through some other friends, and she had gone to acupuncture school. And so she was actually an astrologer and an acupuncturist. And I went and was treated by her a few times. And at some point in time, someone gave me a gift of an astrology reading. And so she pulled my chart and she said, "Oh, you're either going to be a transpersonal psychologist or an acupuncturist." And I'm like, "Oh yeah, that's really going to happen here, because I'm working for a physician group in a hospital. I'm trained in Western. I have no time to go to school. I'm not moving to Colorado. I work 7 to 7, 5 days a week, maybe weekends. There is no way that is ever going to happen. But thank you, Dr. Imsara. I appreciate the input, and I'll keep that in mind." And that was probably one of the first times I learned not to question Imsara. Because now she was early, because that was probably now, I don't know if that was redeployment or post. I got reactivated for a while there in 04 and 05-ish. But she had predicted this, and then in 2013, the acupuncture school for the first time ever opened up a night class. And it was like, and I never should have known about it. It wasn't very well advertised. It was one of those things that for some reason somebody had sent something, or something appeared on my phone about, there's a night, we're going to do an acupuncture night course.
There was an ad in back of a comic book, probably.
Yeah.
Like
may have been.
Written on a napkin.
Yeah, somewhere. But I was like, okay, well, I'll go talk to them and see. And sure enough, I ended up getting enrolled in it. and got through the 5-year program in 3.5 years, and while working full time and going to school at night and seeing patients at the clinic on at nights and weekends and everything. But interestingly enough, it was the only night course they ever offered, and it just materialized at that one point in time where I was able to go. I had progressed far enough. Things were working well in my job. We had a great set of leaders that came in. We developed and things were moving along. So I actually had felt comfortable enough to be able to study and work at the same time.
Mm-hmm.
And so I ended up there, and since that time, I had a clinic in Bradenton, Florida for a while. Then I moved and worked for UAB Medical Center in my Western medicine business job for a while. Talked to some friends in Alabama, or met some new friends there in Alabama, because Alabama is one of the few states that doesn't have an acupuncture act still. I think there's only like 3 or 4 left. And then I was debating on whether to go back to Florida and reopen my clinic, or I had a good friend here, Dr. Serena Rubesh. She had came here, let me see, she's coming on 3 years, so probably in 22. She had been in school the same time I was. She was in school on the East Coast, and I was in school on the West Coast. We'd met at conferences, and we had worked on the Florida State Board of Acupuncture as well together for a little bit. But she had opened a clinic here, said she was doing really well, really liked the Eastern Shore, loved the people, asked if I would be interested in coming out and possibly helping her open a second clinic or join her practice. So I came to the Eastern Shore in the very beautiful month of February, March of last year, and saw the how beautiful it could actually be in the gray. But there was no snow last year. So, if I'd have come this year for the first visit, who knows? The story
might have been different.
Might have been a different story. But I came, and so then May of last year, I moved to the Eastern Shore. And I've been helping Dr. Serena. We now have 2 clinics. We have one here in Belhaven, just a few blocks away, and then we opened another clinic up in Accomack in August. And so it's been very rewarding in getting to work with the people here in that regard. And so there's my 25-minute long elevator pitch.
No, that was great.
So you made it seem like the transition was pretty easy, but it had to have been a lot of apprehension, because you were trained in Western medicine. You're under that, you're around other individuals who are of this like-mindedness, I guess you could say. You probably saw like a lot of weird glazes at you with their eyes, knowing that you were going to go to acupuncture.
That's a very good point, David, and thank you for that. Yeah, I am one of those unicorns or anomalies. I grew up in the Western medicine world. My mother had been a medical secretary, ran a physician's office for, I don't know, my entire life. I had been a paramedic for a while. I had worked in Western medicine. I had also worked in lab tech and phlebotomist, doing community clinic work. So, and then through the military, working in aid stations and with physician groups and residency programs, I knew a lot about physicians in Western medicine and how that all occurred, and anesthesia and all of that. But there was always something that was just a little off. And when let me tell you, if it's an urgent matter, Western medicine is absolutely the end-all, be-all. You break a leg, you have a heart attack, you stroke, absolutely you want the very best Western medicine you can get to. Trauma, battlefield medicine, absolutely cannot be beat. But the idea of health and wellness overall And if we start looking at even things like the Pareto principles, where we're finding, or 80% of your population should be healthy, and 20% should really be the sick people that you're spending a lot of resources on, or who have chronic diseases or have things like that. But in America, that didn't seem to fit right. It seemed like it was more maybe 50-50 or 40-60 or something. And so I was like, well, there's something missing here, and what can that be? And so when I went to acupuncture school is when I started really learning about more wellness and health, and getting the body into a balanced system or a balanced state so that you stay healthy. Our American culture, depending on how you want to look at it, the standard American diet, or as we call it, the SAD diet, is not necessarily great. Heavy fats, heavy salts, a lot of preservatives, a lot of chemicals, and that has an impact on the body. I mean, high fructose corn syrup, issues with your circulatory system, how it's processed within the body, etc. But so we got that. And then the lifestyle of America: it's work, high stress, go. Coming out of the military, also go. How many days can you go without sleep? How far can you push yourself, etc. And in Chinese medicine, it was more around balancing, coming back and finding a point zero or a point of balance. Okay, you push yourself, but then you have to rest and recover. And so now I've seen my practice as I've moved into that, and I talk to my patients a lot about one of the big secrets for acupuncture is we're working to take your body out of this sympathetic or this fight or flight system that you're in, because you're at work, you've got family obligations, you're playing in a sport team, you're doing something competitive, but there's always a competition, there's a drive of some sort. And we can take that out and drop you into a sympathetic system, which is the rest and digest instead of the fight or flight. That is the point where the body really gets to heal itself. And one of those critical times is at night when you're sleeping. So if you can get down into that theta level of rest, is when the brain can clear itself, the body can start repairing itself. A lot of chemical reactions occur to maintain health and homeostasis for your body. And that's one of the key factors I think that acupuncture does, is it helps you achieve that homeostasis and drops you into that parasympathetic system, not just at night when you're sleeping, but throughout the day or during the treatment time. And then the effects of acupuncture, as we're finding out through more and more studies, because acupuncture has been around for 3,000 years or so, but we're finding that the biochemical effects that are triggered tend to increase for the next 48 hours, and then they start declining. So you're really getting maybe a week, 5-7 days out of treatment. And so, you may have been really stressed, but we've brought you down, and now, 4 or 5 days later, your stress starts coming back up. You come in, we can treat that again, or work with you to develop a plan in order to maintain or teach you how to try to maintain your stress levels at a lower rate as well. So, and within the Oriental medicine or realm, I'm probably a little strange, although I will have to say over the last 5 years, it has been really interesting the number of nurses that I've seen come into acupuncture that, used to be labor and delivery nurses, cardiac nurses, ER nurses, trauma nurses, but there are nurses that are moving into Chinese medicine, and they're also bringing that Western mindset, because they have also seen or recognize that the acute care is amazing, but we could do a better job with our continuing and wellness care within the Western system. So in that regard, I'm a little different. I understand the basics of chi or energy, blood flow, blood stasis, the questions, the balancing meridians. So I have all of that, but I also bring that Western mindset to it. So, like today I was talking with a patient about, she asked what was chi. In Chinese medicine, chi is the energy within your body and how it flows. But from a Western standpoint, it's the biomechanical forces, it's the neuroelectric forces, it's the
something that's like more quantifiable versus
this nebulous etheric
right, something
thing
that we don't necessarily know, but that's okay.
Right. And so one of the interesting things is that we're finding now, especially with the use of functional MRIs in research, because one of the stories we used to always tell is, oh, well, I have a headache here. Why are you sticking a needle in my foot? That doesn't make sense. But your headache went away. Yeah. Well, what we found is within the body, the fascia, there is a fascia train that starts at the corner of your eye and goes up over your head all the way down the bottom of your foot to your little toe. And for us, that is the urinary bladder meridian. And it's been listed in Chinese medicine for 3,000 years with various points along there that treat different aspects of the whole body, internal organs and everything else. But it was only, in the last few tens of years that, people really started dissecting the fascia train out, because usually you just cut through it if you're doing a cadaver dissection. It's that white part you see if you're at the grocery store and you have a rump roast or big steak that you think is marbling.
Yeah.
And it's that real tough fibrous tissue in there. That's the fascia. And that is the number one or number two most electrically conductive tissue in the entire body. And so part of the Western science is by sticking a needle in there, we're causing a piezoelectric current that is being transmitted along that fascia train, either into the spinal cord or into a region of the brain to trigger a response, either a release of a biochemical or a gating effect to decrease pain within the body, or just to signal the body that, there's an injury here, because we just created a microtrauma by sticking something in the body that says, hey, send more red blood cells, increase their circulation, send white blood cells, send local beta endorphins or pain-relieving molecules into this site. But there is science behind the woo-woo stuff or the ethereal stuff, and that research is now coming out and showing with every passing year that this stuff works and that there's a reason for it. And it does fit within the greater scope of healthcare, whether we're dealing with psychology and counseling, surgery, internal medicine, disease management, any of those issues. We are one more component of that. And it is very, very promising, at least from my perspective. I'm starting to see more physicians start to recommend acupuncture to their patients, either for pain management or some chronic disease management and things of that nature. And I always found it funny that when I was in Florida, down there, I didn't necessarily get a lot of physician referrals, but I had a lot of dentists and surgeons who were coming in and having me work on their hands so they could maintain their flexibility and keep working and keep seeing their patients. So that was always interesting. But it's still kind of new concept, but I think it is being accepted more across the Western medicine things.
Yeah, and that's really interesting to me. I have lots of questions already. But here's my take on this, right? So you come from a similar place to here, the Eastern Shore, just in Alabama. Could be somewhat, conservative, and, you stick to what you know, right? And now you go into the military, right? Which is a similar mindset. This is my analysis, right? Could be wrong.
Yep.
And then you're exposed to this new concept, right? And it sort of changes the way that you think. And I think that is kind of like where this podcast tends to be heading, is exposing people to new things and, discovering new things and trying to spread it to, everybody on the Eastern Shore. So I'm not very familiar with how the acupuncture process works. Can you just take me through, right? I show up tomorrow at your office.
Good. I can make you an appointment tonight.
All right, there we go.
Not a
He's
problem.
accepting. All right.
Let me flip out the phone. And
How
we'll get you
long does
scheduled.
it? How long does it take? Do I have to have? It sounds like, from what I'm understanding, I don't necessarily have to have a headache, or I don't have to have something wrong. It's more of like maintaining that internal, chemistry.
Yes.
That right. So take me just through what would be like a typical appointment.
So for us, Dr. Serena and myself, when you come in, the initial visit is going to be like about 2 hours long.
Okay.
And we're going to spend the first hour or hour plus asking you lots of questions. We're going to ask, about your diet, how are you sleeping, past injuries, medications that you're on,
Mm-hmm.
are you happy with your job, are you happy with your wife, are you your spouse, is there anything that's a stressor out there? And you may or may not tell us, and we may or may not know. At the same time, we're also doing visual assessments for you. In Chinese medicine, they teach us to read the face and kind of read an aura, listen to the tone of your voice and how, as well as your hair and your fingernails and everything. So we're assessing your health. Even when you walk in through the door, we'll be watching, how are they walking? Are they favoring one leg or the other? Is one shoulder higher than the other? I mean, it's very similar to things that I think that chiropractors probably do and physical therapists and physicians do. But we also do that same thing, but we're trying to get a total health picture.
Yeah, like a holistic approach to this is
Yes.
what it sounds like, which is really cool.
Right, because a lot of people, they may come in complaining about one thing,
Mm-hmm.
and then through the interview process and as we work on that local issue, we start finding it's a bigger issue. And there's something else out there. So it's a little bit of detective work, and we uncover
That's
it.
kind of cool.
And we work with the patient for them to recognize what the real issue is and to seek the therapy or change in behaviors that they may need for that, as well as what we support them physically.
Mm-hmm.
So after the interview, and we decide what your issues are and are what things that you are looking to work on. Because some patients will come in and they'll say, oh, it's my right shoulder and my left knee, my right ankle and my back and this and that. And that's overwhelming.
Yeah.
So, okay, so what's your priorities? What impacts your life? Let's focus in on those. And then once we work on those, then we can move on to the other things and eventually address everything.
And that goes to like what you were saying as far as Western medicine, right? You want a quick, Western medicine will fix it, right? But if
Yes.
you want this long-term approach to health,
It's going to take a while because I see a lot of neuropathy patients, pain in their hands or their feet.
Okay.
It may be due to diabetes, or it's a change in feeling. Some patients will say they feel like they're walking on sponges. Some patients say they feel like their feet are on fire, or they don't feel their feet anymore at all. And it could be different issues, but really we're impacting the health of the nerve and the circulation in the extremities. So we have to work to increase that and to try and regulate and repair. Most people, when they come in with neuropathy, have had it for 5 to 20 years. And they, they want, oh, can you fix me in one visit?
That's what most people want. Yeah.
Exactly. And I'm like, no, we can't fix you in one visit. We can work with you and we can eventually get some of that back, but just nerve tissue on itself, I think, regenerates like 6 or 9 months. It's the slowest regenerating tissue in the body. That's why if you have surgery, you'll often feel numb for an area because it takes a long time for the nerves in that area to grow back and reconnect within the area. So we see a lot of people that are used to Western medicine that, yes, let's a medicine to change my chemistry or a surgical procedure to correct this or that. But Chinese medicine and Oriental medicine is a little longer. It takes more. You didn't get here overnight. I can't fix you overnight.
Yeah.
And so we look at issues. Did you just injure yourself? And so is it an acute problem that you've had less than 30 to 90 days? And if so, well, then we should be able to get that turned around pretty quickly. Maybe in one visit, maybe in 5 or 6 visits. If you've had something for 5 years, 10 years, 15 years, it's going to take a lot more visits in order to get to that because, A, we have to address your local symptoms, but then usually we're going to find out there's something else underlying it. It may be your diet. It may be your work exposure. It may be
your spouse,
childhood trauma. It could be somebody that just keeps you, wound up, either scared or angry all the time. And so then that has an effect within the body.
Yeah.
And so it takes time to work through all of those as well as getting the body retrained. Because that's one of the other things that I found fascinating about acupuncture is for people who have been in pain for a long period of time, as we treat, and there's been studies out there, we actually end up rewiring the brain so that pain, if you have chronic pain, it's like you get a wagon rut between your point of injury and a certain part of your brain. And so it becomes a well-worn path. When we start acupuncture, we start trying to block the pain from getting to the brain and then developing other paths through the brain so that the brain is not receiving or recognizing or labeling it as pain. And so it really plays into the neuroplasticity that has really come about in the last 10 to 15 years within Western medical science as well. So that's, and to me, that's just fascinating.
That's really cool.
We can place needles in you in certain points and manipulate it, and
so that's
changes.
where I was getting at, right? I get my assessment, and then I show up the second time, and I'm laying down or I'm standing, like how, and then you're just poking me with stuff,
just poking holes,
just poking holes. I mean, that's
the tail on Charlie.
Like inform me how that works.
Well, we don't stand you up against the wall and just throw the needles at you. I'm sure there's some Chinese masters that could probably do that and say the needle will find the point where it needs to go to, and it'll zoom in. But now we're dealing into quantum physics and everything else.
Yeah.
But even during the first appointment, after the initial interview, we'll have you usually lay down on the table. For people who cannot lay down for one reason or another, physical reasons, we also have a chair they can sit in, or we accommodate to see how we can work with patients. So you'll lay down and we will place needles at certain points of your body in order to stimulate a reaction with your body that we're trying to get the body to recognize.
Not like a physical, like jerking motion. You're talking like a reaction chemically.
Yes.
Okay.
Yeah. And they are not Western needles, because as soon as I say needles, most people get all scared and worried about it, because in the West, we generally see injection needles.
Yeah.
Where you're putting something in the body or you're taking it out. You go in, you get a blood test, they shove a big needle in your vein and blood pours out, or they stick a needle in, they pump fluids into you. You could take 20 to 25 acupuncture needles to put inside the hole of a Western needle, because we are really dealing with super thin, I call them cat whiskers.
Cat whiskers.
They are so small and delicate when they go in. Now there are different gauges of needles and different depths, so we can get thicker, but usually they're very thin, and most people don't even know when they've had a needle stuck in them.
That's what I was going to ask next. Yeah.
So if we do stick a needle in you and you get a burning sensation, well, then my X-ray vision is not working very well. So I either got down a hair follicle, or maybe I touched a small capillary or venule or something, a blood vessel in there. If we go in and you get an electric shock, we got a nerve. So we can either back it off or move the needle a little bit. And you need to let us know that, because we don't want to cause that extra pain. And sometimes if you get just like a heavy, dull ache, our teachers and masters would call that dachi or dachi. And that is a good thing. That is because you're now really signaling the body in to bring attention to that area. It's not necessary that you get that every time. And it was interesting during training, we found that traditional people, especially Chinese and Koreans, they absolutely demand like a dachi sensation. If it's not hurting, it's not working.
Wow.
Americans, we don't like pain. If it's hurting, it's like, why am I coming here to you?
Yeah.
He got me one time. Right in my knees, and my knees are very sensitive, all the surgeries and stuff I had, and he hit it just right one time, and he makes fun of me now because every time I come back in, he's like, "Don't worry, I won't touch your knees anymore." Yeah.
But it helped, and he started playing basketball
There
afterwards.
you go.
That's right.
Well, that's what I was like. Do I come in and I'd like, yeah, I'll take the regular today, or is it different every time? Are you like assessing this throughout the process?
Yes. We assess you every time. I will have patients who will come in and say, I've had a very stressful week. I just want a relaxation and a regeneration, or I've been extremely fatigued and tired. What can you do to boost my energy? Or my back is hurting, my knee is hurting. And so we assess and work on those areas that come up.
So now with me,
let's get into it a little bit.
When I first started, you actually, after the needle insertion, you were hooking up electrical leads to that. And what is explain why that is and how that actually enhances everything.
Okay. So, and that is one of my specialties. I really like electroacupuncture. As I mentioned earlier, anytime we stick a needle into a person and we touch it or we generate or spin it, we are causing a piezoelectric current, a small current within the body, in order to feed the tissues. I use electroacupuncture because I look to feed the tissue more, because I can't sit there and twirl needles for 30 minutes for every patient that comes in.
Yeah.
And so, and we are also finding through research that different tissues of the body react to different frequencies. And so I will attach electro clips, and then I will use different frequencies based upon what that person's complaint or issue is. And recently, like 3 or 4 weeks ago, did a CEU class over the weekend, where now we are starting to use two different frequencies with two different machines in the same area in order to set up harmonics. So we, instead of just getting like 2.3 or 4.6 hertz for a traumatic injury, which will reduce inflammation, increase release of beta endorphins and pain relieving chemicals, and start the healing process and cellular reproduction process for repair, we can now tag one machine at 2.3 or 4.6 and then the other one at 73 or 76 hertz in the same area. And so now you're getting multiple frequencies coming in, and then you start getting harmonics and you get multiple frequencies. And so maybe part of the body needs the anti-inflammatory, but another part of the body needs the cellular repair and regeneration, and another part of the body may need cellular regeneration too, but bone regenerates at a different frequency than muscle does, which regenerates at a different frequency than nerve does. And so by using these harmonics, I'm now trying to address multiple issues within the area. And we're also using the spine a lot because now we can, by working off the spinal or the nerves that come off the spine, we're finding that we're able to go out and feed the internal organs as well. So we can do some internal medicine. So this theory is based on like I'm blanking on the name of the theory right now, but the idea that the body as a whole, you want to keep it as clean and healthy as possible. And so for many years, everybody looked at the human body as a bag of chemicals. Mm-hmm. You know, we got sodium and chloride and potassium and everything. So you have an ache or a pain, here's your medicine, because it's made of different chemical compounds and it gets in the body and it reacts in different ways. But if we take that down one more level and we start looking at it at an even more basic level, we see that the chemicals themselves have a positive and negative charge. Sodium chloride, chlorine negative, sodium positive. And so it's necessary for your muscles to be able to contract and work with your ion pumps with that. But they're carrying an electrical charge. So what if we just add electrical charge? And, studies were finding that cancer cells tend to grow or multiply when the human body gets around now my numbers may be off here, but I think it's like plus 30 millicurrent or plus 30. The normal human body for health is like minus 30. And then tissue repair and regeneration needs to be a minus 50. Basically meaning we need more electrons in the body. And so by adding the E-stem, we're adding electrons into the body through the needle. And we're using the needle because the skin is the least conductive tissue in the body. It's the most resistant. TENS units, a lot of people use them. They're a lot of good, but it's difficult to get that charge through the skin into the underlying tissues. By using the needle, we're able to direct that current into the muscle or along the blood vessel or next to the bone or close to a nerve in order to help feed and furnish it the electrons it's needing a little better. So it's really cutting. It's exciting that it's cutting edge medicine for this ancient tradition that's been going on for thousands of years, and that what we're now learning to do. Several years ago, there was even a study going on, and I think it may still be ongoing at UCLA or UC San Bernardino, where they were using acupuncture needles for paraplegics and quadriplegics in order to be able, because they were thin enough and small enough to get into the spinal cord and stimulate in order to try and get the spinal cord to regrow, to be able to overcome these paralysis. So that is amazing if we get to that point as research goes through.
Well, I know I've seen it so far that just in the little bit of research that I've done since I've been seeing you is frequencies. You brought that up a while ago, and how certain frequencies can even regrow teeth and organs and tissue, and how we are slowly going that direction, but it was something that was known 3,000 years ago.
Yes. And I think, that is some of the history and some of the things we talk about, especially like through the Egyptian time periods, and even as we're finding those pyramid cultures, both in South America and Asia as well, that there appears to be a level of technology that was quite common that we have lost over time for whatever reason. And as we continue to explore and work through the archaeology of that, we're learning more. But it's exciting that we are rediscovering it on our own as well.
What did you see just recently, the imagery that they took under the Great Pyramid in Giza?
Oh, I did hear something about that. What was it?
Well, they used SAR, so they used sonar to gather this picture and found that...
Oh, it's like a ship or something.
No, this was structure
Rooms.
that goes at least 2 kilometers into the earth below the pyramid, and how it's we don't know what it was used for, but we just know we've always felt and understood that there was much more to the pyramids than just a tomb.
Mm-hmm.
And now this imagery that has come out and was released shows this structure. I don't know if you can bring it up or not, Lucas, when we talk about this, but it's completely, blowing the narrative out of the water. And it's like, look, we need to continue looking at this, because we're going to find these lost technologies. See, that's the structure that they found.
I remember it. Yeah, that's crazy.
It is. And so what's under the Sphinx? What's under the other thousands of pyramids from around the world that they're just now going out into the mainstream, that people have known about for a while too? But it shows you that it's just a lot more than, hey, we buried some king in here and that's all it was used for.
Oh,
yeah.
Oh, absolutely. I think 5 years ago, maybe 4, I was in the Great Pyramid at the bottom where they had been excavating, and they're like, yeah, we're still excavating. We found this massive hole that was just going down, down, down. It's like, there's more under here, but we don't know what it is. And it takes us so long because they are literally pulling it out one bucket at a time out of there and up through this long, narrow passageway up to the top to dump the dirt outside. So it's a laborious process, but if you ever get a chance to go in the pyramids or into the Queen's Chamber, the King's Chamber, you will certainly recognize that there is more in those structures, and the harmonics and the frequencies that you can hear just by speaking and off of the rose granite or quartz that's there is just phenomenal. And
I'll put it on my bucket list.
Yeah.
Oh, absolutely.
Me too.
Yeah, and I have some good contacts for you.
Okay.
Who can
Sweet.
get you in close to see some authentic
Okay. Very cool.
Egyptian stuff. So
that's interesting because it sounds like, this is cool because we're discovering new stuff every day, right? How developed is, to get back to acupuncture really quickly, how developed is this field in your personal opinion, and how much farther is there to go? Do you foresee a time when, I can hook my own self up to one of these EM machines and it's in every household? Like, where do you see the what's the future of acupuncture, I guess?
Good question. You can kind of do it now with a TENS unit, but that is going to be on the surface.
Mm-hmm.
And a lot of people are a little leery about taking needles and sticking needles into themselves. And,
Yeah.
and I will tell you that when I treat myself, I have to think about which needles I'm going to put where, because if I'm treating something on the right side, once the needle goes into my hand, I can't move it because the nerves or the pain or bends the needle. And so I have to be careful about how I'm doing it and where I'm doing it and what I can reach.
Gotcha.
Back issues, obviously I can't treat myself.
Mm-hmm.
Well, not supposed to anyway. It's a guess at best with what you're seeing. So there's, like any type of medicine, there's, over-the-counter remedies and there's over-the-counter things that you can do. But to really, one of the other kind of laws that or suggestions or principles that we look at is you really can't treat yourself. You need someone else to treat you, because part of that healing process, kind of tying into the Egyptian pyramids and the energy and physics and quantum, is there's also a healing between patient and practitioner. And there is a giving and sharing of the energy from the practitioner into the patient that becomes that quantum entanglement that we were talking about, one of your students were talking about earlier, that assists or provides that extra little oomph to the patient, or acts as a guideline for them to find the truth that they're seeking.
That's cool.
So I think there is acupuncture is definitely a hands-on medicine. And that's the other thing I like is when I was in the service and then coming out and working a lot, I noticed that used to doctors and nurses would touch you. And nurses especially, they would comfort and they would dress wounds, they would help massage and do bed baths, but they were touching the patient. We have kind of gotten away from healing touch or touching the patient. Acupuncture, we still have to touch a patient. We're still putting a needle in, we're still palpating, finding the sore spots or the ashi points as we call them, feeling the underlying structure, where is the bone, where is the muscle, where could the nerves be coming through. So we're doing a lot of palpation and touching, and I think that is important for the patient-practitioner relationship. And I think by placing that needle, when you're balanced and working well, you're also, we'll get into a little spiritual esoteric here, you're also pulling energy or heavenly chi down through you into the needle, into the patient. So it's like a universal conduit. But it's also quantum entanglement of, you need more here, so let me help you. Putting an outreach.
Wow.
So that's why when patients come in, one of the first questions, if you ask me what is acupuncture, I'll say, do you want to talk Western, Eastern, or woo-woo? And I will meet you wherever you are and try to explain it in the way that's comfortable for you, because that is also part of what we're trying to do, reach every patient, is where they're at. And some people are comfortable, some people like woo-woo. A lot of people prefer Western and maybe an Eastern. And I really like it, because a lot of my patients who were Western medical people, nurses or physicians, they're like, okay, well, tell me Western. And then they're, okay, yeah, I got all that. Now, how does that translate into Eastern? And so they're looking to draw those analogies and how the parallels set up. And okay, I can understand that now. and it helps them become more familiar and more at ease with the practice, which I think is a good thing. Is we are starting to become more accepted, but you also have to think that acupuncture didn't exist in America until early 70s, after Richard Nixon opened up China and brought some of the first Chinese people and Chinese acupuncture into America, and starting in California. And so really it's only been around
50 years.
50 years.
That is wild. I didn't even know that.
Yeah.
So that's been our exposure.
So what do you say to someone, a hater? What do you say to someone that says, "Oh, acupuncture is pseudoscience," or
Witchcraft.
yeah, right? Or it's like a spiritual, because we spend a lot of time talking about spiritual alignment, right? And that requires some form of faith in a way, right? Believing in something that,
It's higher than us.
yeah, right? So what do you say to those that say, "Oh, I'm not going to get acupuncture because it's a bunch of BS," right? It's all,
I'm sorry you feel that way. We've got 3,000 years and billions of patients treated and billions of success stories, and right now you're just not miserable enough of being miserable enough. And so, but we also find that oftentimes we're the last resort. People have gone to multiple other providers, so they usually end up in the acupuncture office pretty close to last resort.
yeah.
Or maybe next to last resort of, we are getting good referrals from orthopedic surgeons and neurosurgeons, neurologists, and say, try acupuncture, go try this. Otherwise, we're going to have to do this major invasive surgery or something. And so then they come, and sometimes we can fix them and they don't have to have it, or sometimes we can strengthen them so when they have it, recovery is much faster for that aspect. But it's funny you had that ask that question, because I have a patient who recently came in, has had chronic knee pain for a long time. Treated him, had phenomenal results. Able to walk without pain, go up and down steps, just got his life back. Says he's no longer mean or grouchy. His whole attitude, his whole outlook on life has changed. He's a much happier person, enjoying life, going out and doing more things now than he was. He ran into a friend who asked him, "Oh, what drugs are you on? What are you taking?" He's like, I'm not. I'm doing acupuncture. He's like, "Oh, that's BS. That's voodoo. That's
right."
He's like, and he just said, "Well, look at me. I'm enjoying life. I'm doing great. I'm going to acupuncture. I'm not taking any other drugs or these painkillers. It's the acupuncture that's done it for me. Believe me or not, that it's your choice. But here's Steve's card. Give me a call."
Well, the proof's in the pudding. It's climbing up those stairs and running up the stairs and not realizing it, right?
Yeah.
What, if any, are there any negative effects? Like, why would I not do this?
So every patient is different, and every biochemical makeup of every patient is a little different. So we usually see a bell curve within our patients. We'll have some patients that, get better immediately, one or two near miracle cures. Then we have some that, we can treat many times and they don't show much progress for whatever reason. Either they resist, or it's the wrong treatment or the wrong points or something. But most people are going to fall in that bell curve, and they're going to show increased wellness and benefit up to a maximum level. Things that may come about, you may get a bruise because we're pushing a needle in. Like I said, X-ray vision doesn't always work. If you're on blood thinner or anything of that nature, there's a high likelihood you're going to bleed a little. and it may be a little bruise or it may be a big bruise.
Yeah.
Just depending. Some people have needle phobia, and they really send themselves into a panic attack and get very lightheaded or dizzy. In Florida, I did have somebody that nearly passed out, but we just pull the needles out and calm down, and they're able to go back to self-regulate.
Mm-hmm.
There's usually not an allergic reaction because we're using single-use stainless steel needles that generally don't have any sort of allergic reaction with anybody. And then, sometimes, depending on where we go, we may get near a nerve impulse or something, so you may get an electrical shock. Or you may jump and scream and say, "What are you doing?" So, but we can remove the needle for that.
Mm-hmm.
But it is one of the probably least negative side effects type of treatment you can do.
Okay.
And I take that for granted because I went into acupuncture with a little bit of an idea what I was getting myself into, because the research that I accomplished just on my part with everything I had going on.
Yeah.
Knowing that a lot of my condition was caused by Western medicine way of thinking, and the research that I had accomplished, knowing that it was from the anthrax vaccine and the other chemicals that I was exposed to while I was in the military. And so when you mentioned that a while ago about when people were going in and as a last resort, like for me, it was the only resort because I knew that's what I wanted to do. As soon as I had a diagnosis, I remember telling my wife this. I said, I am not going to be another guinea pig. I'm not going to be in a part of these clinical trials or taking Skyrizi or whatever else you got out there now, which I'm not knocking any of these. I just know that going into it, I was more comfortable than most people are. And so I had the time because really that's all I had time. I knew that I had multiple sclerosis. I knew that I had and what it was from. And I was looking for that holistic, natural way of healing my body and wanting to truly heal my body and not just throw more chemicals or whatever else at it for this.
Yeah.
And I was bringing that up because I just from my personal experience with this is that this may take a couple years, it may take a couple months, but I was ready for that. I was like, no matter how long it takes, I'm going to ride this and have needles all throughout me like Pinhead, and there's a couple times where you probably did have 30 plus needles in me, so there is multiple things that you're healing at the same time too.
Right.
Yeah.
No, we've hit multiple areas for you for sure.
Well, how much? That's a good point because you were ready, right?
Mm-hmm.
How many of your patients are ready versus, and how does that affect the final outcome, right? Versus those that are resisting.
Yes.
Like, do you have to believe in this for it to be effective in a way?
You gotta be somewhat open to the cosmos.
That's
for
what
this.
That's I think where we're going with this.
I think you absolutely have to be open to it. Because I think you can look at any treatment modality, whether it's surgical, pharmacological, therapy-based, or acupuncture, and you're going to find that you can have a certain number of people that may have back surgery. Some of those are going to be miraculous, never have pain again. Some are going to be worse off. Most are going to feel better. So it's the same thing, but it's good to be open to the idea and recognize what's going on and be optimistic because it is part of that belief of your own mindset because it is you and your mind and your body that you're healing. I'm simply here to assist you. You're really the one doing the healing. We're just helping along the best way we can.
Wow.
But a lot of it does come down to attitude.
Well, it's been massive for me too, because from a psychological standpoint, like I was in a pretty deep, dark place.
Yeah.
Because I was like, man, I have this condition. What am I going to do? I really didn't. Well, of course, not understanding and knowing what I had at first, that was a long journey. That was a year and a half of testing and trying to understand exactly, okay, what do I have? Why am I having these issues? And so not only has it healed my body, but it's truly healed my spirit as well.
Wow.
Well, thank you for that, David, because that is, you're like one of our best walking advertisements, because that's our goal or our intent is to heal the body, heal the spirit, heal the mind, heal the soul.
Yeah, because you're besides throwing chemicals at it, like you mentioned earlier too, in the military, I remember I had a wing fall on me one time. I was lifting a wing with my back with the U2s to put the landing gear, we call them pogos, to put the landing gear into the wings. You have to actually go out and physically lift the wing up so another airman can go out and stuff the landing gear underneath of it so it can actually taxi back to the hangar. And so I had back issues. And of course, the first thing I want to do is throw at me is 800 milligrams of Motrin. If that doesn't work, we'll throw some type of opioid at you, and we just got to get you back out into the front line. Yeah. So it was crazy to even know that you had soldiers from the Far East that actually had this in their med kits, that had needles in there that could...
Yeah, I had no idea. 3,000 years, yeah. That's insane.
But we've only had it for 50.
Yeah. Well, that's this is I feel like a great analogy for what we were talking about the other day about, is it Aquarius? What
we're going into the age of Aquarius.
Yeah, right.
So we're in the age of Pisces going into Aquarius.
Right, and how I don't know if this is the correct word, but a sense of enlightenment and, understanding like the knowledge behind, sort of like what you were saying, moderation, like Western and Eastern sort of coming together, right? Finding a way. And so how do you think that acupuncture can sort of help us with some of our today's societal problems, like in terms of nutrition? And because from what I'm understanding, this is also a form of therapy, right? This is a mental as well as a physical. Like, how do you think that with a changing society, this could be the solution?
So acupuncture is actually one aspect of Oriental medicine. The other aspects that we do are herbology, or using herbs in lieu of drugs, but naturally occurring compounds. We also do tuina, or manipulations, massage type of things for joint issues. We use moxibustion, or heat into certain points of the body, cupping to draw blood and circulation out, gua sha to also, when you get adhesions within the body, to strip and break those adhesions so the tissues move smoother to reduce the pain, increase circulation. So acupuncture is it's the most well-known of the Oriental medicine modalities.
Okay.
And so it's kind of a leader in there. But within that, then we can start getting into different schools of thought, like 5-element, earth, fire, wind, water. What's your constitution? What's your mental makeup? How do you approach life? How do you see things? Do you have too much fire? How do we balance that with water or earth? Which we do with acupuncture by choosing different meridians and different points on the body in order to bring that out. The eight major vessels in balancing that, Dr. Tong's balance method. But one thing you see through a lot of it is balance, yin yang, the Tai Jin symbol. I saw you had it drawn in your notebook there, is finding that balance and knowing that there is light within the heart of darkness and darkness within light. But finding and allowing things to flow and come to a balanced situation. And I think it's really important. But acupuncture is, in Oriental medicine, is kind of, I think, on the forefront of what I think the future will be, which will be an energetic or vibrational medicine. So like for cancer, for years we've fought it with either burn it out with radiation, cut it out with steel, or salt the earth, poison it with chemo. We're finding, our research is showing that certain frequencies can disrupt the cancer cells and get into the right harmonics and cause them to shatter and break apart and destroy themselves. So I'm not attempting to do that with cancer and acupuncture, but you could theoretically use electricity and acupuncture needles to do that. You could also use sound and vibrational, or setting up frequency beds or sound beds. You can also use chromatography for some issues, or applications of colored lights on certain parts of the body, because you are setting a frequency and the body is responding to that frequency in some way. And I think ultimately that becomes what we should look at, because currently for the last 100 years or so, you nearly have to kill the patient in order to cure them with cancer. And it's very, very, very difficult. And attitude there is also so critical. And I would tell you, my mother was diagnosed with renal cell cancer. They told her she had 6 months to a year. She had an amazing attitude toward it. She wasn't going to let it get to her. She took it to her church. She had people praying for her. She was faithful. She was diligent. She did everything the doctors told her to. She lived 5 or 6 years.
Wow.
Beyond her time, because she had the positive mental attitude about it. And then she had a clinical trial that she thought was the next greatest thing and was going to be the one that would help her, keep her going, and she didn't get selected. It broke her spirit, and she died within 2 weeks. But it was that breaking of the spirit of them saying, no, we're not selecting you. But for years, she had maintained that positive and working, always looking, but it finally just got too much to her. And when they told her no, it broke her spirit. She had dinner with my aunt and uncle. She went to bed that night. She didn't get out of bed anymore after that. It just broke her.
Wow.
So back to your earlier question, mental positivity is key no matter what therapy you're in. And it certainly is beneficial in the field of Oriental medicine and acupuncture too.
That's cool.
We're just working with more subtle realms.
Yeah. Right. So you talked about how this is probably the method we should do, some of these things, right?
In my opinion.
Yeah.
I am not an MD.
No, this is about opinions, right? This is a perspective, right? We're sharing, and this is so the thing that I have, like, my question is, like, how much does capitalism and some of these medical companies profiting off of these drugs, how much does that influence your ability to spread this message and spread awareness? Do you foresee it as a barrier? Is it just sort of out there? Just like, how much influence does that have over doing what we should do?
We are a capitalist nation. We are a capitalist world. Money drives everything, no matter which country you're in. Western medicine is hundreds, billions of dollars of cost and treatment. Chemotherapy, recognized and paid for by Social Security, by insurance companies. Acupuncture, not recognized.
That's where I was going to go.
Not supported. Some insurance companies will offer a rider or a special clause. You can pay extra in order to cover acupuncture, but it's usually a limited benefit. I spent 25 years physician in hospitals fighting insurance companies to get paid for our treatments for everything in the hospital. Some insurance companies just will have, we'll allow you $500 toward chiropractic, massage therapy, and acupuncture. Alternative therapies, $500 a year, and we're paying, everything else.
Yeah.
So we are not funded in any way except by the patient. And that is a barrier because...
I bet a huge barrier.
It is, because people think that if they pay for health insurance, then health insurance should pay for their health or pay for their treatment. But you pay for your health insurance, but it doesn't cover health and wellness. It's covering sickness. It's covering drugs. It's
reactive instead of proactive.
Yes. That's why it was interesting in school and everything. They were talking about, and I believe it was China, but I can't cite the right study. It was just stories from my teachers that physicians in China were paid when patients were healthy. If you were a village acupuncturist or doctor, you got paid to for people to stay healthy. And when they got sick and required more resources, it came out of your pocket.
Wow.
Instead of here, somebody gets sick, it goes in your pocket. So that's a little hard to think. And I thought about, well, would that work in America? And then I turn the TV on, I look at the commercials for all of the foods and all of the drugs and all of the other things. I'm like, no, because we have a system we have too many competing issues.
Well, it starts off at a very young age, and I notice this more and more when I turned the TV off years ago, and every now and then I may watch a ball game or something just because I love baseball or the college basketball tournaments going on.
Yeah.
And you see all the commercials, and it opens your eyes. Like, there's fast food, there's there's buy a car to spend more money. So to say, like, most expensive car, you need a new car, but it's this drug, that drug, and then beer, and then soda, and then it's all these things that bring you down, bring that chi down, bring that health down. And it's in schools. You're not taught any of this as you're growing up. Like, you literally have to go out there and do the research on your own, because the indoctrination that we go through as from children all the way through doctorates and then CEs and so on and so forth, none of this is ever brought up unless you ask about it, unless you go out yourself and do it. So that herd mentality is strong. So it's hard to break that herd mentality.
I mean, we're a consumer-based economy.
We are.
The economy runs because people consume gas, food, energy, medications, etc. So it can only operate as long as there is a demand. And so, we'll create, Ozempic or some other drug. We'll have a demand by what we put in the food over here.
Right.
And so if you step back and really start looking at things from a global perspective and start thinking about how do things fit together, it's like, oh, this is...
I think that's what this is all about, right? So...
Yeah, it becomes very elaborate, and you have to go, oh, this is really smart. It's not healthy, not good for me as an individual, but the idea of how we're playing our food system, our health care system, our consumer system, our insurance system, our transportation system, and how everything is interwoven is really pretty fascinating.
Yeah, and it's, for all of this, it's all out of pocket expenses for everything that I've been doing. And then my wife and I were just, over the weekend, we're doing our budget and looking at how much we spend on food, because most of our food is organic, non-GMO, whole foods. We're going to different places, and the amount of money that we spend on healthy foods just for the five of us is astronomical.
Oh, I'm sure.
Oh, absolutely.
I'm talking like a couple $1,000s a month that we're spending on groceries just to keep us healthy.
Mm-hmm.
Because
Right. And then when you can't afford that and you're stepping down on the quality of the food and you're getting into more processed foods or more what we would call in what we called in school white foods, white flour, white rice, heavily processed, white sugar, all of that is bad for the body and sets up all of these other disease processes, because 80 to 90% of everything that's wrong with anybody is either diet related or stress related. If we control those two, we take out a lot of the chronic disease and issues that are ongoing. We're still going to have traumas. We're still going to have accidents, car wrecks, heart attacks, strokes. Yeah, there is that. But kidney disease, liver disease, pancreatic issues, cancers, a lot of it is either nutrition or stress or a combination thereof. And when you move down and you have to consume food on the lower end of the scale because it's cheaper, because it's manufactured or made or has more chemicals in it, you're exposing your body to more potential issues, more dyes, more things that aren't naturally occurring.
Right, and also too, it affects your brain. It affects the way you think. I mean, you have the chemicals and of course the metals and stuff that get into your brain that go through that blood-brain barrier and affect like the pineal gland and calcifying your pineal gland with fluoride. And fluoride carries aluminum to there, and so you're not even able to think properly anymore. Though you're not able to pick up the frequencies of the universe, and because it's blocked, and so it causes even more of a herd mentality, and so on and so forth. So it's definitely a by design.
That's what I'm wondering, right? Like this herd mentality, is this something that is imposed upon us? Do you believe that there's somebody who knows right and wrong and they're making the wrong decision? Like, what is your opinion about that?
Good question. That can be multiple podcasts, probably. Multiple ways of looking at that, and depending upon...
Let's just talk about, like, in terms of food, then. Let's take that lens.
So I'm going to take a down the middle approach here.
Okay, I like it.
I'm going to say that there are some issues with food that came about for the right reasons, or at least a right intent. Maybe not the right reasons, but a right intent. And then there are other things that I think are less than positive for how those things have ended up in our food chain.
Yeah.
And so one of the things that I think had the right intent was wheat. And, over the last 20 years, we've seen a huge increase in gluten sensitivity and digestive issues, leaky gut syndrome, etc. Well, if we go back to the, 70s, I think, we were so worried about famine and extinction around the world that we really started playing with our food production system, and we started hybridizing wheat and corn and other things. But wheat, you listen to the America the Beautiful and the amber waves of grain, when wheat used to be really tall and had the kernels and everything, and man and wheat evolved together.
I agree.
For thousands of years, and we learned to digest it, we learned to eat it. All of a sudden, you start in the 70s, we start hybridizing, we start gene splicing, we start messing with changing it at a faster pace in order to increase the yield, in order to have more food to keep people from starving. So, right intent, trying to prevent starvation, trying to do the right thing. Unfortunately, we accelerated the evolution of wheat by who knows how many hundreds of thousands of years. The human body did not evolve at the same pace. We cannot necessarily process the modern wheat as efficiently and effectively as our body would process the older wheat. I have a lot of friends who travel to Europe and back, and they talk about how great the breads are,
Yeah.
and how they can eat over there and they have no digestive issues and it's wonderful. And they come back to America and they eat, they get sick, they get diarrhea, constipation. Something goes wrong. They have a different type of wheat, one that's still able to be assembled by the human body versus what we have and what we grow overall.
And that's like with dairy too, with over pasteurization and how it's being shown that it has an issue with lactose intolerance now because your body's not able to process it because of the pasteurization.
Right.
Right?
Yep.
Yeah.
No, so I mean, there are things like that. We have the right intent. We're doing things for the right reason, for the greater good, but sometimes technology gets ahead of the human body, and we have unforeseen repercussions that happen that may not be. But then we have industries around creation of preservatives or food colors or things of that nature to go into the food system to make it look better, make it appear richer, to be more appealing visually, or to taste or enhance a taste. It may not be the best thing for the body.
Wrong intent.
I
can say it if you don't want to say it.
a more commercialized intent.
Yeah.
That is only looking at one part or one aspect of how do I increase sales or how do I do this, and not regarding what else happens downstream.
So it seems like
maybe a more narrowed focus that doesn't include everything.
Well, it seems like if these problems are, continuing with specifically food, right? You got great job security. Like acupuncture is the way to go.
We are one of many if we can convince people to come in and try this, but part of that is also modifying your diet, like going more organic.
Yeah, there you go.
Going back to the original grains or sprouted grains or fermented foods, things that feed your microbiome in your gut, your prebiotics, things that help you maintain a better homeostatic biochemistry system within your system and keeps you kind of alkaline instead of acidic where cancer starts.
That's a new concept for me.
The numbers he was talking about earlier.
Yeah, having our body having a specific charge on it and being able to control that and manipulate that is really interesting.
Exactly, and that can be, I think that is what the future of medicine could be or should be. I don't know that if it can be monetized or how it would be monetized or anything, and that will be where the industrial leaders look.
Let's start it right here.
Yeah, there we go. Well, that was a follow-up question I was going to have is like, what we were talking about, what should we do, right? And some of these medical companies, some of these pills and drugs are highly profitable. Versus acupuncture seems less profitable.
Yes.
Is that correct, or?
That is correct.
Okay.
I will say that last time I worked in the hospital, there were treatments, either procedures or medications that could be $50,000, $80,000, $200,000, $250,000 for a treatment. Come into acupuncture, you're not paying.
But you're not covered by insurance, right? So there needs to be some sort of meeting of the minds, it sounds like, to
somewhere.
Yeah.
We'll get there eventually. I mean, because you're even saying a while ago, there's still a few states out there that don't even allow the practice of acupuncture.
Yeah, what was that? You mentioned the acupuncture law or something like that?
Right. So every state, well, every state has a board of medicine that sets up their rules and regulations for how medicine is practiced in the state, as well as dentistry and veterinary, etc. Acupuncture, not all states have an acupuncture practice act. I think Alabama doesn't. I don't think, is it Kansas? They may not have, and maybe one of the Dakotas don't recognize acupuncture. Doesn't say you can't practice, but there is no board and there is no protection for you in that state. There's no restrictions either, so it can be a little bit of a Wild West.
That's what I was getting ready to say. Yeah,
you're rolling the dice. You know, you can probably go and do great things like,
Be careful.
or unusual types of treatment, because in China they will also do bloodletting and massive moxa and heat and things. And some people who study in China are very good at that.
Mm-hmm.
So if you're in a state that doesn't have those boundaries, you could probably do it. Now you get a patient who gets a burn, gets upset, turns you in, you have no protection either.
Yeah.
So you're putting your life, your license, everything on the line for that. And then each state has different practice parameters. I'm licensed in Florida, so in Florida I can do vitamin B12 injections, vitamin C injections, herbal injections, things of that nature, trigger point injections for pain, etc. We're not allowed to do injections in Virginia. We can't do any of that here because the practice law is different. You can in Florida, you can in California, I think Texas, you have injection ability, and some others. But every state is a little different.
That's interesting.
I think it's in Massachusetts or Maine, an acupuncturist can perform acupuncture on humans or animals. Florida, the Veterinary Association and our racehorses and everything else absolutely forbid acupuncturists from practicing on animals because there is a big agriculture and big horse racing and dog show issues there. So they didn't want acupuncturists in that realm. So they said, no, you can't. But now we're also finding, many states are allowing physical therapists to do dry needling or trigger point needling. So there's different points on the body where the muscles will cramp. They can take a needle, either an acupuncture needle or a Western needle, and go in and stimulate that area in order to create a release. Sometimes we found that in some states they have actually ended up puncturing lungs. So that may be one of the issues. That's probably a side effect that can come about from acupuncture. Is you could puncture a lung, or you could get a major organ or heart, but you've got to have a really long needle and really kind of be hunting for things for that. So that's the biggest adverse risk. But usually, most, if they're an inch needle, we're not getting anywhere near anything major.
Gotcha.
So,
sounds like legislation needs, right?
Legislation.
Ultimately, how do we mainstream this idea? Legislation, right? Test firsthand trials.
Yep.
Right.
Right.
And so especially in Florida, but also at the ASVA in Washington, D.C., and introducing legislation through our professional societies in order to have it recognized by Medicare and or other insurance companies in order to start paying for those modalities.
Yeah, that would be huge.
Yes, it would.
That's the first
I bet you. Yeah.
Yeah. So I mean, that's the biggest, block right now. Physical therapy paid for, mes- internal medicine paid for, surgery paid for, psychotherapy paid for, prescriptions paid for, acupuncture generally not paid for. So that it is above and beyond, and we recognize that with our patients, and so we try to work with them as much as we can.
That's awesome. Yeah, I know this has been great for me. I'm just tend to take this side of like being a skeptic a lot. Maybe it's the scientist in me, but you've got me. I think I'm a believer in this.
Good.
Yeah. So
That's good to know.
We'll get you scheduled tonight.
I know. That's what I'm thinking. I think I might need to go in for a visit or something.
Absolutely. Plenty of availability. We can find you a spot.
Very cool.
Well, is there anything else that you would like to? I think it's a great thought to have you back on later, and we'll get into some deeper from the woo-woo side, especially.
Okay.
That's where I want to go. I want to go to the woo-woo. Yeah, definitely.
Okay. Well, just give me time to brush up on some of the esoteric acupuncture and some of the more spiritual aspects of what we do, because currently practice is mainly focused on physical ailments, physical pain, internal medicine, psycho-emotional issues, etc.
And there's a lot of stuff too that we talk about in here that we won't publish as well, unless you really would like. I mean, it's because we could get really deep, and there's so we have to be careful too, because we talk about that amongst ourselves, is that we're trying to just throw nuggets out there to the general populace, and we want them to be comfortable with the things that we are talking about, and we just kind of, as it's brought up, we'll feed a little bit more until eventually it becomes mainstream, so to speak.
Yeah.
So
no, that's amazing. Y'all are, I think, right on the mark and the time for getting that out, and I think it's becoming more widely accepted. I think there's getting to be, as you were alluding to earlier, about the enlightenment and a thirst for knowledge that people, especially after the last several years of, well, where did COVID come from? What caused it? What's good for it? Follow this rule, but oh no, that actually makes you sicker and has other complications. I think people are more critical of what they're told now, and they're searching for information, which is always a driver. I think if we go back in history and look at the Dark Ages, where everything was controlled, the amount of information was very limited, and it was controlled by very few people as to what went out to the populace, and there wasn't a lot of growth. And then you hit the Renaissance, or in stage of enlightenment, where information just starts going everywhere. You get the printing press, and now books and Bibles, and because once upon a time, in the Dark Ages, people couldn't have Bibles. Only the priest could have the Bible to read the Bible and tell you what was in the Bible. And then Gutenberg started printing Bibles, and people started reading for themselves and thinking for themselves, and the Reformations, and there was a big upheaval. And so with the internet, as it continues to grow, and the availability of platforms like this, is there going to be that renaissance or that revitalization of information out there? But then how are people going to balance that against AI and misinformation? And how easy is it, as we've seen, to program AI to give misinformation?
right.
And then how do you, who controls that, or how are things set up? So sorry about that. So that if one site says this, or one robot says this and another robot says this, which one is right? And it's all goes into the programming and the data that goes in. And does one have a message that they're trying to get across that they have a bias or an interest in? Or does the other one have a bias or interest in getting a message? And how do we get to, here is the knowledge, here are the things that actually happen without,
filtering it
or people putting their hands on the scale one way or another.
Gosh, you know what? And that light bulb, because you just said it. It makes podcasts like this even more important now than ever, because we can still deliver the accurate information out to people, so they don't have to rely on AI, rely on reading some press that you don't know who controls that. So that's awesome stuff. I mean, it excites me even more that Lucas has started this now, because we're able to do that from the tiny eastern shore of Virginia going forward. That's cool stuff.
It's super cool.
Yeah, no, I think it's wonderful what you guys are doing and what you're presenting, and thank you so much for having me on and letting me ramble and
no, this has been perfect.
It's been great. It's great intro.
Yes,
because when I start thinking about energetics and energetic medicine or vibrational medicine and what we could do and how you could even set your frequency and change your attitudes and your thought processes, and what it could do for mind expansion and expansion of consciousness, where in the past we may have relied on, mushrooms or cactus or fungus or something else to alter to alter our mind. To be able to do that with sound or vibration or inducing within ourself a self-induced state of what the ancients would call ecstasy, which is enlightenment or understanding of the universe and your place within it. It's just really, really exciting things. So,
energy, frequency, and vibration. Nikola Tesla.
Yes. Yes. If you want to understand the universe, look to those three.
That's right.
What were they again? Energy, vibration, and sound?
Frequency. You're right. It's frequency.
Frequency.
Yep. Nikola Tesla said that's the key.
Yep.
Understanding those three.
And then 369.
Yep.
And variations off of that.
Yeah. And like how, that's cool. Super cool.
So yeah, thank you for inviting me on tonight. It's been wonderful. I love the studio and everything else. So.
Yeah, you'll have to come back. Definitely.